My name is Farhad Marzook, and I'll be presenting the preoperative use of glucagon-like peptide-1 receptor agonists is associated with reduced risk of postoperative DVT and mortality in patients undergoing lumbar laminectomy. GLP-1 receptor agonists are frequently used for type 2 diabetes and weight management. Recent evidence has suggested they may also provide cardiovascular and anti-inflammatory benefits. Lumbar laminectomy is a common spinal procedure frequently performed for indications like spinal stenosis and disc herniation. Patients undergoing lumbar laminectomy are usually older with many comorbidities, putting them at an increased risk for postoperative complications. GLP-1 receptor agonists have been studied in the context of fusion-based spinal surgeries, but limited data exists on decompression-only procedures like lumbar laminectomy. This study aims to evaluate whether preoperative GLP-1 use is associated with reduced postoperative complications following lumbar laminectomy. Our study was conducted using Trinetics, covering data from 120 million de-identified patient records across 69 healthcare organizations. Patients undergoing lumbar laminectomy were identified using CPT codes 63047 and 63048. They were then divided into GLP-1 users and non-users within 1 year preoperatively. A 1-to-1 propensity score match was conducted to balance for demographics and comorbidities, and then primary outcomes measured were 180-day incidence of medical complications using ICD-10 and CPT codes. The flowchart at the bottom depicts the patient selection process. At the very end, following propensity score matching, each cohort consisted of 4,220 patients. For the results, the table shows all of the complications that were measured, with DVT and mortality showing decreased risk. At the very bottom, we have a forest plot plotting the risk ratios and confidence intervals, again with mortality and DVT showing a decreased risk. And so these findings align with preclinical and clinical studies showing that GLP-1 receptor agonists reduce thrombosis via platelet inhibition and endothelial protection. They also lower mortality through systemic improvements in glycemic control, inflammation, and cardiovascular health. The LEADER trial, which was liraglutide in over 9,000 type 2 diabetic patients over 4 years, showed a 15% reduction in mortality. Other meta-analyses also support the mortality-reducing benefits of GLP-1 receptor agonists in high-risk patients. This all suggests potential perioperative value beyond glucose management. Prior research on GLP-1 receptor agonists in spine surgery has been mixed, particularly in fusion procedures. Our study is one of the first to show benefit specifically in decompression surgery. As a retrospective observational study, our findings cannot establish causality. However, the strength of our match data and consistency with prior literature underscore the clinical relevance of GLP-1 receptor agonists in reducing key postoperative risks. So to conclude, this study found that the use of GLP-1 receptor agonists preoperatively was associated with a reduction in DVT and all-cause mortality following lumbar laminectomy. No significant increase in other complications were observed, and further prospective studies are needed to confirm these findings and evaluate the role of GLP-1 receptor agonists in postoperative optimization protocols. Thank you for your time.